everyone. So I thought I'd go through a video just explaining a bit about how the breathing system can have an effect on your movement system and flexibility, just so that when we go through some of the exercises and the tests you have a bit more understanding about how it works. So basically working on the breathing system can have a really quick and direct influence on mobility throughout the body, and it's a little bit different than the traditional approach of stretching a muscle that's tight or feels tight. So we'll go through the theory here a bit, so excuse my average art skills, but basically what we're looking at here on the left side is normal breathing mechanics. So the green circles here are representing exhalation, so when you're breathing out, and inhalation when you're breathing in. So if you imagine looking down from the top of the body, when you inhale you want an expansion through the back of the body, front of the body, through the sides, so basically three-dimensional. And when you exhale you want opposite happening, compression into the front, back, sides to help push the air out. So when that happens you have a sort of a movement that happens through the spine and the whole body to help accommodate that. So you have a exhalation, you have a compression through the back, through the front, into your back, creates a little bit more of a curve, your belly pushes in, diaphragm pushes up, and that helps get the air out. So when that happens, you get a little bit of a tilt forward of the pelvis as well. And then when you breathe in, the opposite happens, you get an expansion through the back, through the front, the spine kind of starts to curve open a little bit more, opening through the lower back, your belly pushes out, diaphragm pushes down, which pushes your guts and organs down, and then your pelvic diaphragm moves down as well to help accommodate that. So when that happens, your pelvis actually tilts back a little bit. So when you're breathing normally, there's sort of the nice dance between these two movements, and that helps create nice movement through the spine and throughout the whole body. So generally we see when there's normal breathing mechanics, there's good movement through the shoulders, through the hips, people can touch their toes, do a nice squat, so everything's looking pretty good. But it's very rare to see normal breathing mechanics, especially in the clinic. So what often happens is you start to get a compensation, and this can happen through life for many different reasons, and again really common. So there's all sorts of different compensations that can occur, and you can get compensations on top of compensations, but a couple of really common ones are that you might get a restriction into the front of the chest, so we're getting airflow into the back and the sides but not the front, and that could create a little bit of an extra curve through the mid-back, and then your lower back may accommodate that by getting a little bit more lumbar lordosis or curve here, pelvis tips forward. Another common one is to get a restriction into the back of the rib cage, sort of that between the shoulder blades area, and then also the front. And then here you might get a bit of a flattening through the thoracic spine, but again the pelvis may tip forward just to help with the breathing mechanics. So when you get these sort of compensations, obviously it has an effect on the spine, but can also have an effect on anywhere through the body. So your pelvis, your hips could get affected, your knees, ankles, shoulders, elbows, necks, basically anywhere. So when we're looking at trying to restore movement, trying to improve pain and function, this is where we start trying to get the breathing mechanics coming back to normal. So in terms of addressing it, it's really hard to just look at someone and guess, okay, there's the restriction, this is happening. So we need to use some tests that give us an idea or a picture of where the restrictions are and what's happening through here. So we'll go through some of those tests and then some of the exercises that can help with that as we go along. But yeah, send me through any questions about this. I'll go through some more stuff later, and then we'll catch up soon. Cheers.